잠깐만.
시작도 안 했는데요? 왜?
근데 너무 무서워.
괜찮아요. 다시 크게 열어주세요.
잠깐만. 나 못할 것 같아. 너무 무서워, 진짜. 근데 진짜 너무 무서운 것 같아.
안녕하세요.
안녕하세요. 네, 저 김재영이라고 합니다.
저는 김미나 박사라고 합니다.
네, 오늘 시간 내주셔서 정말 너무 감사드립니다. 오늘 진짜 날씨도 좋고 해서 저희 맨하탄 배경도 조금 찍고 할 겸 저희 피프트 애비뉴로 나가서 조금 얘기 나누고 그리고 들어가서 인터뷰 진행하도록 할까요?
예.
네, 알겠습니다. 네. 근데 진짜 며칠간 진짜 계속 오다가 저희 오늘 날씨가 너무 좋아가지고 I really wanted to walk outside and talk to you a little bit outside and kind of show, Manhattan as well. When I first received your resume, I was very, very surprised. And I was just like, oh my God, this is just one person's resume or is it two people's resume? 막 이렇게 보면서 그러고 있었는데, you hold so many titles as a founder, president, doctor, you lead so many organizations as well. 어떻게 그렇게 inspiration 받았는지 for voluntary works, internship 그런 거 어떻게 받았는지 좀 얘기해 주실 수 있으실까요?
I've really had wonderful mentorship. Two of my mentors, one was Dr. Lois Jackson and the other was Dr. David Shipper. And really, they kind of opened the doors for me in a lot of ways. So currently, I'm the president of an organization called New York County Dental Society.
Oh, wow. Okay.
We serve about 2,000 dentist members across
2,000?
Manhattan. Yes,
Wow,
close to
okay.
2,000. And really, our main mission is to ensure the well-being of dentists and our patients. To make sure dentists are practicing in a way that's safe for patients.
Is that only like active dentists or retired dentists, residents, or how does that organization involve?
Yes, active
Organized.
dentists are obviously welcome to be part of our organization, as are retired dentists and residents.
Oh wow! So what are the some of the activities that you guys do within the organization?
Well, one of the most important activities I think we do are community outreach.
Okay.
So I started a program called Give Kids a Smile, or at least the New York City chapter of it, where we go to underserved neighborhoods and we educate the children on how to take care of their teeth, and we provide dental screenings.
Oh my God. Okay, that's a very good way to kind of give it back to the community as well. When I saw your resume, and then I was very surprised when I saw your education, history, and you went to all the really big name schools. And how did you get inspired to go to the big name schools? And also, how did you get into it? Give us some sources. How did you get into those schools?
I guess I studied hard.
Okay.
So I guess part of it was I studied. But also, so I practice currently with my father. He is also a dentist. His name is Dr. Mina Kim. He also actually went to Columbia to dental school here.
I wish I went to Columbia.
But I've always wanted to be in Manhattan. So that's why, even though I applied to schools across the country, I really wanted to be in a school that was in the middle of the city because I knew I would be here one way or the other.
I see. And, 한국 사람들, they always want to go to the big name school. 그런 친구들, those people who's out there who wants to become a dentist later and who also wants to go to, big name schools. 그런 친구들한테 한마디 해줄 수 있는 말 어떤 말이 있을까요?
근데 요새 솔직히 제가 갈 때는 더 쉬웠어요. 요새는 너무 힘들어요.
그런가요?
근데 공부도 잘해야 되고요. 근데 공부 말고 잘 할 수 있는 거가 필요해요. So you have to have something you're good at, whether it's a hobby or sport. And that's what I find very consistently amongst those students who are younger than me.
Oh, I see. So try to find what you're good at. Not only just education, but well around yourself.
I think that's really important.
I see. You found an organization, right? You found a women's network organization called?
Yes, it's actually called Women to Women Dentist Network. I co-founded that organization with one of my mentors, Dr. Lois Jackson.
Okay. Now you became a mentor. So what are the activities that you do at your network?
It's mainly fun networking activities.
Oh, wow. Okay.
We had a private event at Tiffany's. We did a museum event
Oh,
where we
wow.
looked
Okay.
at art. We actually did a chocolate event.
Oh, that's bougie.
Which is funny as we're dentists, but you know what? Everything in moderation is okay.
I mean, chocolate.
It's funny as a dentist, but you know what? I eat chocolate. I'm sure you eat
I
chocolate.
love chocolate.
And it's okay. It's okay to eat chocolate. We just always have to remember to brush our teeth, right?
그리고 you mentioned about the big, what is it, the smile for the kids? What was
Yes, give kids a smile.
Give kids a smile. I'm sorry. Yeah, give
That's
kids a
okay.
smile. So can you talk a little bit about the Give Kids to Smile
Sure.
activities?
So within the United States, less than 50% of the population actually get regular dental care.
50%.
Less than 50%.
Oh my God.
Yes.
Okay, that's
it's pretty horrible.
that's horrible.
Yes. And actually that number is much higher, especially in areas that are underserved.
Oh wow.
So first, one of the things with Give Kids a Smile is we go to underserved areas, we go to the schools, we educate children on how to take care of their teeth, and we provide free dental screenings, and we make sure that we can refer them to somewhere where they can get treatment, even for free in many cases.
And it's for free service. It's a free service.
This is a free service. It is sponsored by the American Dental Association and Henry Schein, Colgate, and a bunch of these large dental companies. They provide a lot of the equipment.
Wow. Okay. How did you actually start this activities? How did you think of this activities?
Well, this is actually an existing activity, and
Oh,
I
it
did
is?
it.
Okay.
I volunteered with Give Kids a Smile as a student at Columbia.
Okay.
And when I was practicing as a dentist, we didn't have this sort of program. As we represent almost 2,000 dentists in New York City,
Yes.
we have a huge volunteer force.
Oh,
it's a shame
yes,
for
yes.
us not to do anything. So I wanted to make sure to go that, we've been so fortunate in the education we received and that we're able to help patients every day, but there's so many people who aren't able to receive dental care. So that's why it was so important to me. Recently, we were actually at NASDAQ with Henry Schein, who is one of the sponsors of this organization,
Okay.
to ring the bell. So I was actually asked to speak there.
Oh wow.
And one of the things that I think people are very surprised by were there are children as old as the age of 11 that we have seen at this program who have never seen a dentist in their life.
For
Ever.
11 years.
Yes.
Never.
Never.
Wow. That's crazy. That's
In the
that's
US.
horrible. That's horrible.
It's really sad.
Nobody would have thought about it. I mean, people not going to dentists until they're 11 years old,
They've never been.
and they must have a lot of dental problems then.
Sometimes they do, sometimes they don't. But it's prevention is just so important when you're
Yes.
taking care of your teeth, right? Not just our teeth, but just overall our health,
Yes.
right? So many medical issues can be prevented. And I think it's important for myself as a dentist and just as a healthcare professional that we educate patients and the public on how to take care of your teeth
Yes.
and how to take care of your overall health.
I think people got a little more aware. They have a little more awareness of a preventative medicine after COVID-19. I think
so.
Because not reactive, not to be reactive to what they receive. They have to be preventative. They have to be prevent to not get any disease or to not get any not get hurt.
Yes. I mean, I think mental health, right? It was a big issue during COVID where
Yes.
a lot of things came out. And I think people were just not taking care of themselves. As dentists, we were closed for 3 months during COVID.
Yes.
So a lot of patients that I'm like, hey, we really should take care of that filling. Obviously, during COVID, a lot of people just weren't able to take care of their dental
Yes.
health. When they finally came in, something that could have been taken care of in maybe
Like
a
months
30-minute
ago, yeah.
appointment, now is taking maybe 3 appointments
Oh,
that are an
wow.
hour each.
I mean, when I was trying to find an appointment after COVID-19, it was hard to find an appointment too, and also I had to get my dental work done and also cleaning done, but I couldn't find it for 3 months because, people are going in, they were rushing in, and what they were actually telling me was some of the patients would have to come visit multiple times. That's why they're just booked. And I think it's very important when you mention about preventative medicine, as in if we could prevent it, then we don't have to go to 3 appointments. Then we could just, like you said, we could finish it in 30 minutes, but that becomes a 3-hour work rather than a 30 minutes work.
Absolutely.
yes.
And it's not even time, it's just also cost.
Yes.
Right? And Really, and I think one of the things I'm luckiest about practicing with my father, I've never had the pressure of, I need to like see X number of patients a day or do this many procedures. So I've really been able to focus on the health of the patient, right? Because you're going to have your teeth for a very long time.
Oh, yes.
Our life expectancy in the US for women, I think, is about 83 years old.
Yeah.
In Korea, I think it's like 86, 87. So since we are living so long, you know, a lot of our parts probably were just not designed to last that long.
Yes.
So we have to make sure to take care of our teeth and the rest of our body at a very early age.
Yes, and we got to take care of them, like you said. One more thing that I wanted to talk about is before you wanted to become a dentist, you actually weren't working in a medical field before.
No, I wasn't.
Yes. So can you tell us a little bit about where you worked in before?
I was a legal assistant at one of the very big law firms. It was a really good experience. I learned so much about being in the corporate world, which I otherwise would have not worked in. But I think long term, I wanted a profession where I felt like I was interacting with the patients, and I feel like I could see more of a direct effect, a positive effect that I'm having on people. And also, it's also, in addition to helping my patients, it's given me the opportunity, like stuff like Give Kids a Smile. I also work with the Special Olympics. And I don't know if I would have had that opportunity as a legal assistant to do that kind of work.
So you wanted to be more direct to helping other people. And I really admire what, all the works that you did. But you mentioned about the Paralympic,
Special Olympics.
Olympics, I'm sorry. Special Olympics. Can you elaborate a little bit about it? What you do as how do you volunteer? How did you get involved with that organization? And what do you do as a dentist?
Sure. So Special Olympics is an organization that works with people with intellectual disabilities.
Okay.
And it provides a place where they can be athletes, they can work in teams, they can be leaders of their teams, and really, be champions. In addition to that, it also is the biggest database of anything medical related for patients with intellectual disabilities, even more than the hospitals.
Really?
Yes. So Special Olympics exists across many, many countries, not just the US.
Oh, not only United States, okay.
So they have a program called Healthy Athletes. And within Healthy Athletes, we do Special Smiles, which deals with teeth. At the time, a lot of it is education of the athletes. We do the screenings, and the event we participate most often is at the Javits, the hockey tournament.
Oh, wow, okay.
So when you're playing hockey, right, I can hit you in the with my elbow, and you could knock out your tooth. Rather than doing that, we make them a athletic guard.
Okay, so I didn't know you guys actually volunteer for. I didn't even think about dentists would volunteer for any of the Olympic works. I thought it would just be medical doctors.
No, it's great. There's nutritionists, podiatrists, all sorts of doctors.
Okay.
Because actually, patients with intellectual disabilities, you know how I said 50% of the population doesn't go to the dentist?
Yes.
And this population, that number is most likely much higher. A lot of dentists and just healthcare practitioners, we're not educated in school on how to treat this population. Of course, now we are more aware, but even when I was in school, not as much. So this organization, volunteering with it, it's wonderful I feel like we get to help these athletes, but also they're helping us. I have more familiarity now with patients with intellectual disabilities. So when I have them in my office, for some of them, I can see in my office, rather than them going to have to go to the hospital.
I see.
Or, a clinic setting where they're waiting a very long time for an appointment.
I see.
Like they can come with maybe their family members and be seen at the same time. And like I said, prevention is so important.
Yes.
If these patients that we're seeing, that we're taking care of things early on, this is less visits that they're going to the emergency room where they have to be sedated in like an operating room in order to take care of their dental treatment. So again, prevention is so important, but really for this population, this is really one of the most vulnerable populations. So which is why I think it's really important.
And it's great, and I think the fact that you are there physically to help them out, and also the fact that you're spotting their problem and beforehand it becomes a problem. I think that's what's crucial and important. And also you mentioned that you're getting a little more familiar how to deal with this different type of patients and different type of groups. You're getting familiarity, and also it's more of a give and take, and as in you guys are learning more as a dentist as well, that how to deal with this population, how to give better care for these population. And I think that's really important, and the fact that you guys are collecting data for that is important. 아 근데 치과가 좀 무서운데 근데 또 하니까 it was okay.
괜찮지요?
네네.
That's why prevention is so important. I think a lot of patients, they get so scared if they haven't been to the dentist in a long time. Then I think once they've done it, they're like, hey, actually, that wasn't that bad. And sometimes, if you wait a long time and then all of a sudden you have a lot of issues, it can be very overwhelming.
Yes.
So you really want to tackle that early on. So actually, I think one of the reasons I became a dentist was my father had a patient. She probably hadn't been to the dentist in like 15, 20 years.
Oh my God.
I know.
Yes.
And she came like this.
Okay.
When she came into office.
부끄러우셨구나.
너무 부끄러웠어요. 이빨이 보니까 막 까맣고요. 입 안에도 좀 많이 아프셨어요. So then seeing that I've always been fortunate enough to have dental care, but seeing the contrast, I was like, oh wow, this is, 그렇구나요. Like 사람들 really that have so many dental issues, this is what can happen. But, she had gone to the dentist and then she got scared, maybe kind of like you.
Yes.
And then maybe she'd be like, oh, I need so much things, would be intimidated, leave and just not come back. And finally, I think my father instilled in her the importance, like, hey, you need to take care of this. You're only, probably at the time she was about 50 years old. You're only 50 years old, you're not going to have teeth.
Yeah.
In like the next 3-4 years, if you go on like this. Finally, she took care of her teeth. And as she went through the process, she became much more friendlier. And then slowly, like this kind of came down. Oh. And at the end, when she kind of was done, she had a lot of work done towards the end of her treatment. She would greet us with a big smile.
아, 너무 진짜
So it's 조금, it's so like, I was like, wow, I can make this sort of impact on people.
혹시 그런 부분에서 did you get inspired to become a dentist? When you 그런 거 봤을 때? Because you mentioned before when we were in the street, you mentioned like, 이런, you wanted to be more directly 그렇게 influence 주고 싶다고 사람들한테 더 help 해주고 싶다고 그런 부분에서 혹시 약간 were you inspired to become a dentist?
Absolutely. I was in the corporate world before I went to dental school. And I thought, I was going to get my JD MBA, like go up the corporate ladder. And that was kind of my goal initially. After, I spent some time working in my father's office while I was interviewing at other places, I saw the positive impact that you can have on someone's life. And that made me want to be a dentist.
근데 정말 힘드셨을 것 같아요. From legal to become a dentist. 어떻게 그렇게 하셨어요?
솔직히 조금 힘들었어요. 저는 원래 사이언스 같은 건 잘했는데요. 전공 was economics and mathematics.
Okay.
So 다시 학교 가서 사이언스 클래스를 다시 했어요. 그런데 치대 먼저 갈 때 most of the people, there's some sort of bio major. They're pre-med, so they've taken a lot more science than me. So when I went, it was a lot of, I feel like I had to study a lot harder initially.
I see.
I recommend to anybody who wants to go to med school or dental school or any healthcare field, take as much science as possible in undergrad. Even if you have to retake it later, it's a lot of coursework to catch up on. So the more knowledge you have beforehand, I think the easier it will be.
I see. 그렇게 조금 hardship 같은 게 있었음에도 불구하고 you became a very successful dentist. 그런 와중에서는 I'm pretty sure you had a lot of mentorship in between. And then, you mentioned earlier as well, you need to seek for a lot of mentors. 그런 거 혹시 조금 어떻게 찾을 수 있는지, what are some of the sources, what are some of the ways that you could look for mentorship? And also, what would you recommend to other, arising dentists? 어떻게 좋은 덴티스트가 될 수 있는지 조금 얘기해 주실 수 있으실까요?
I mean, there's the clinical aspect, right? The clinical aspect, it's about practice, it's about taking courses. But there's also like how you interact with your patients, the business portion. And I think this I've learned the most, again, from mentorship. And how I found these mentors is from networking. I make sure I go to about 2 dental events a week and at least 1 non-dental event a week.
Wow.
Right? I think it's very important to interact with non-dentists as well. I was very involved with CALCA, which is now CKA, in the past. And from there, I actually met one of the CEOs of a very large dental supply company called Henry Schein. And that, his name is Stan Bergman, and he gave me a lot of opportunities, including connecting me with certain people. I was allowed to speak at NASDAQ in front of 100 people and help ring the bell. I was accepted into this program, diversity program at the American Dental Association. So again, you never know where you're going to meet somebody. So I really urge, not just dentists, any career that you're in, network. You need to network within your industry, but also outside your industry. As a dentist, stuff I learned from the outside, I feel like it just helps me relate a lot better to my patients. 재영 씨도 무섭잖아요.
네,
올 때요.
너무 무서웠죠.
근데
네.
그런 환자들 되게 많아요. 근데 처음부터 좀 얘기 나누고
Get to know each other.
예, 더 편하면 환자분한테도 편하고요.
네.
저한테도 더 편해요.
그래도 조금, hardship이 많았을 것 같아요. 그런 많은 leadership role 하지만 그래도 중간중간에 또 hardship이 많았을 것 같아요. As an Asian American, but also 여기서 그래도 또 you created a women's network. 그런데 그런 이유들이 있는 거는 아무래도 조금 그 중간에서의 hardship 때문이 아니었을까 생각이 되거든요. 혹시 어떤 difficulties, 그런 게 있었는지 좀 얘기해 주실 수 있으실까요?
Yeah, I mean, 우리 다들 모든 사람들은 좀 hardship 있잖아요.
그렇죠, 네.
And I feel like I've been so fortunate. And even if if somebody says no, I don't really listen. Maybe if I want to do something, I will find a way to do it. I really didn't feel particularly discriminated against as a woman, I guess, because I went to Barnard College, which is Columbia's women's college. So really there, you don't experience it. But definitely as, you're in the workforce, sometimes as a female, especially in a male-dominated field, the men, maybe they bond over sports. Or they all golf together, or they all go drink whiskey together. And, I like to drink too. Like, I don't play golf well, but I'm able to learn. Yes. And sometimes you're excluded as a woman. And even with representatives, partially, I don't know if it could be because I'm a female, because I'm an Asian, or maybe because at the time I was a younger dentist, that a lot of the representatives, the sales representatives, when you're at these events. If you were with me, you'd be doctor, but I'm always my first name, even if it clearly says doctor on my badge. Which, these are people who are trying to sell dental products to you. So it's very strange to do that.
Yes.
I've had instances where if I arrived and one of my male colleagues arrived afterwards, they would help him first, even if I was there waiting.
That's ridiculous.
It's, and there's been a lot of instances like that where in some cases I was really treated unfairly, either because as a woman or as an Asian. So I think it's, that's why I made this women-to-women dentist network.
I mean, during COVID pandemic, I think, I've experienced it, and I think many have experienced it during COVID as Asian, hate crimes. I don't know if you have any experiences during COVID. Have you had any interactions of, Asian hate crimes, or have you experienced any?
So sadly, I think as Asian Americans, if you've been here long enough, even from when I was younger, we've experienced some sort of racism.
Yes.
Right? Whether people, pulled their eyes at you, or called you Ching Chong Chang,
so
or
times.
Asked you, hey, are you Chinese? Oh, you're Korean. What's the difference?
Yes.
Right? We've all been asked that. During COVID, I think this was all escalated, where maybe a random person would yell at you, go back to your country for no reason, or just glare at you. I had someone throw a bottle at me, a glass bottle at me during COVID. I really think all of this was escalated. But I think what I kind of learned from that was a lot of my friends and colleagues that are not Asian had no idea this was going on. There wasn't that much media coverage on it. You have people like Saifan Kim, who was really good, instrumental about bringing it to the public. We have politicians like Grace Meng, Grace Lee, Linda Lee locally, who are very outspoken about it. And now we have like Jeremy Lin, Simu Liu, who, you know, they really kind of talk about it. But I think it's important for all of us. We need to be more outspoken about these things we're experiencing it. And I know because it's very hard. It brings back like bad memories.
Oh, yes.
Right? It feels embarrassing. But one thing I'm kind of proud of that I did was during COVID, I was asked by the American Dental Association, what are some hardships you're facing during COVID? And I talked about, you know, a lot of us were worried because our practices are closed. But as an Asian American, I was afraid to go outside I was worried I'd be attacked because it was happening so much. And so I was interviewed for an article. And after that, I had such an outpouring of support from my fellow colleagues.
Oh, wonderful.
But which was very touching, but very shocking. They had no idea what's going on.
Oh, yeah. Nobody knew.
But that's our fault because we have not spoken about it.
Yes.
We haven't been vocal enough. So I really encourage everyone, even though it's hard, I think we should share our experiences. When our friends hear that this is happening to them, they care more versus it happening to a random person, and it builds awareness. Of course, violence is horrible, right? And we never want it to happen, but ignorance or just not being aware of these things happening is also important.
Yes.
I think one of the things that I was really touched by, one of my friends, she was so worried about me during COVID after hearing what happened. And I guess she talked about it with her parents. And because pepper spray, I guess there was a shortage at one point. She's like, tell Mina to go get wasp spray. So I went to the sporting goods store thinking wasp spray is a brand of pepper spray.
Okay.
He wanted me to walk around with like a big can of like spray for the wasp and then like spray people if they got too close. His point being like, oh, it sprays at like 10 feet, so she doesn't have to get too close. Oh my God. Which is, it's so ridiculous. How do you walk? You can't walk around
you can't walk around with
how do you walk
spray.
around like this? But I was so touched that
People
not
care.
even just my friend, my friend's father was, now was aware of this and was worried about me and was like, oh, we have to buy Mina some wasp spray.
People cared about you.
Yes.
I mean,
it's a little funny, but
I mean, that's crazy. I mean, yes.
It was I was very touched. It was very sweet.
That's very sweet of them. I mean, we went through a lot of hardship, and we went through a lot of, I'm sure a lot of people went through a lot of hardship as well, and some of the, criticism and some of the racism that people had to go through. One of the things that I wanted to ask you is, you've done you've on a very successful path, and you've done incredible amount of work to give it back to other people, and not only to keep it to yourself, to share it with other people, share it with community, and also to give it back to the community and to become a mentor as well. I wanted to ask you, how do you de-stress yourself? From all these stress that you're getting from organizations, foundations, and also the work, how do you de-stress yourself?
I mean, I think I like being busy, number one.
Okay.
So I do feed off of it, but of course I get tired sometimes. So, I have a dog named Vito and who I love, and spending time with him and my husband, Daniel, that kind of gives me like a lot of, helps me de-stress. I love going out to eating at different restaurants. I like wine. That also helps. And then I think, like I said, prevention is so important. If we can prevent disease in our mouth and not need all this dental work later on, that's better for all of us.
Yes.
But also even with our own health, right? Just your body as a whole. So like Pilates, I think exercise is really important. Like Pilates. I'm going to take a tennis lesson later today. Okay. I played a little when I was younger, but my friends and I decided to sign up for tennis camp. So I want to get a little better at tennis. So 저는 뭐 3살 때 제일 하고 싶은 일이 치과의사였어요. 근데 보통 치과의사 아니고요. 강아지만 치료하는 치과의사 하고 싶었어요.
Okay. Yes.
So I love dogs from a young age. I had a stuffed animal dog. I would 끈을 목에다 타이하고 막 길에서 끌었어요. 두렵게요. 되게 두렵잖아요. But I love that dog. Like I treated it like it was a real dog. So when I was older, we got 진돗개, Brownie and Nico, and I really loved them. Whenever I went to eat 갈비, I would save the 뼈 to give to them when I went home.
Oh my gosh, that's precious.
So, when they passed, I was really, really sad. But I wrote a children's book about them.
Okay.
And eventually, I do want to get that published. It's about 진돗개 to expose more people to the breed. There's organizations like 진돗 Rescue, which has done an amazing job in the city. But just, like to the general public, I think they'd love to learn more about kind of what this dog is. And in the book, it introduced like other breeds as well. It's about friendship. And eventually, I want to have other books that talk about Korean culture.
I see.
Like, so Vito, who's my dog now, he's, we're going to have one of the books I plan is when it's his 돌. Because I think it'd be nice, like, we could talk about the Pegir and Dor, some of these Korean customs we have. There's so much interest in Korean culture now.
Yeah, K-pop, K-dramas, everywhere.
I know.
Everyone watches it.
Oh, they asked me after Squid Games came out. They're like, when is the second season coming out? I was like, I don't know.
I don't work in that industry.
I don't know, but they expected me to know. And I was like, I don't know, let me try to find out. I've had patients, non-Asian patients, recommend dramas to me.
Really? Wow.
Yes,
Okay.
Yeah. And then they're the ones who tell me about BTS or Blackpink, these different groups, which is 되게 자연스러워요. When I went to the BTS concert, the person, and I went in Vegas.
Wow, you went all the way to Vegas?
My friend, I had to go for another reason. I was there for work anyway, but my friend happened to be there and had tickets, and she invited me. The person in front of me was from Mexico. The person to my left was from California. Person to my right from England. Flew from
All the way
England,
from
not
England?
even to Manhattan, to Vegas. The person behind me, I think, also from some European country.
Wow.
So it's so impressive that we've had that people are so aware of Korean culture now. And I don't know, maybe this is not the right audience. Beavis and Butthead. Did you ever watch that? You know
No.
that came back? Okay. They were on Beavis and Butthead.
Okay.
This is maybe not. We'll talk about something else. But I was so touched to see all these people in the audience that are not Korean. They knew all the names, not even their nicknames, all their real names.
Oh, wow.
They had like their little
They just connect
cartoons, and they were singing the songs.
all together.
They're in Korean. I can't sing some of the songs unless I learn the lyrics. But they're singing along in Korean.
That's
It's
impressive.
really amazing.
That's impressive.
And I'm so proud. You know,
to be Korean American.
I never thought, like growing up here, that when we used to listen to K-pop in high school, like DJ Dog, like 서태지, Deuce 같은 거.
Yes.
I think H.O.T. My American friends would listen to it. They're like, "What is this?" So I was like, "Okay, this is just something I listen to with my Korean friends." But now that it's K-pop, K-dramas, skincare, food.
Oh, yes.
That it's so big is great. You can't get tables in K-Town.
Oh, no.
I go to K-Town, we have to wait online.
You gotta wait for like an hour.
I know, I want to eat like some 갈비. And I'm like, 어떤데 1시간 기다려야 돼요.
Yes. I mean, lastly, I wanted to ask you, what are some of the goals that you wanted to achieve? Some of your near and far, futures that you wanted to achieve, and some of the goals that you want to achieve. I wanted to ask your goals.
I mean, my goal for this year is really to work with the New York County Dental Society. And my theme for this year is empowerment. I want to empower dentists, empower patients, and our organization as a whole. I plan to empower dentists by making sure to bring up the new leaders. Just like I've been mentored, I want to make sure to mentor new dentists who can be great leaders. Also bringing in more diverse dentists.
Definitely.
It's so important. And also teaching us about treating a variety of patients, not just the patients we're used to seeing in our practices. That goes on to like how I want to empower patients. I work with the Special Olympics because I think it's very important that all patients, regardless of kind of who you are, that they're able to get treatment.
Yes.
So patients with intellectual disabilities, this is one of the most vulnerable populations. We need to educate them, but we also need to educate dentists and other healthcare practitioners so that they can see them in their office more comfortably.
And I really, was actually inspired when you actually said that, not only to educate the patients, but the dentists also they get educated from the patients and how to treat the patients as well. And
exactly.
Yeah, I think to learn each other, and then I think we could make a better community. And also, I really love the fact that you would like to give it back to the community, not only to just hold it, but just give it back to the community, help others, and be better to each other.
I mean, I feel like I've been so fortunate in my life. And just with my family and people who have come into my life who have helped me along the way. So it's so important to pay it forward. And that's again, I mean, after this year, I'm getting my Chinook book published.
Oh yes,
that's my next goal, and
Okay.
you will all receive copies. But after that, long term, I'm hoping I'll continue in different positions in dentistry.
Yes.
And I'm hoping I'm able to develop and have enough influence that I could really have a program that's really impactful for dentists, where we really are able to see more patients.
Yes.
One of the things that I am doing this year with one of my colleagues, her name is Dr. Anya Varone, she sees mainly patients with special needs, is in addition to working more with Special Olympics, we want to visit some of these long-term care facilities where they live.
Oh, wow. Yes.
And not only educate the patients, but educate the caretakers.
Oh, okay.
The caretakers, they're taking care of maybe 5-10 people, whereas the patient is just one person.
Yes.
I think the more people we can kind of educate, and again, like I said, I think we need to work towards just healthier people, healthier mouth, and just healthier
body,
overall.
Yeah, overall.
입이 몸하고 연결이 돼 있잖아요.
Yes.
So 입이 건강하지 않으면 몸도 안 건강해요. That, there's such a link between the mouth and the rest of the body.
Yes.
So I think by the more we can help patients and just people with that, I think the better off we're all going to be.
Oh, yes, definitely. I mean, everything that you said, I mean, I am very inspired, and I'm actually excited that you are going into, you will be expanding on your reach, and then also continuing your community services and also voluntary services. I really thank, everything that you have done, and also I'm so excited to see your new book that will be published, and also I'm very excited of your, other work that you will be doing in the future. And thank you so much for taking your time out for an interview session. And now I'm a little more, encouraged to go see dentists, and I will fix all the problems that I have.
Yes, it's very important.
Thank you so much, and thank you so much for your time today.
Thank you for the opportunity and for having
you.
me with you today.
Thank you.
Thank you.